Hi, everybody. Welcome to another episode of Raw Fork Podcast. I have with me today Dr. Laurahedrick.
Hi.
She's a pharmacist, business owner, and personal trainer. So, Laura, go ahead and take it away. Introduce yourself.
Hi. Hey, everybody. My name is Laura Hedricks. I have been a pharmacist for 13 years. Pretty crazy. Personal trainer for about 5. Recently became a certified diabetes educator. And kind of started my company about a year ago in April because I wanted to try to make it more of an impact on people in a preventative setting instead of after the fact when we're dealing with, comorbidities and medication and chronic disease. I really wanted to try to get in before all that happened, or at least help slow that down for some people, maybe even in some cases reverse it so that they don't have to be on a ton of medications for the rest of their lives.
Yeah, I love that. Prevention can save us a lot of money and a lot of time, and
Yes.
yeah, a lot of comorbidities, as you said.
Yeah.
So also tell us, please, where you grew up and where you went to pharmacy school and why you chose pharmacy as a career in the first place.
So I grew up in Statesville, North Carolina. Went to Campbell University in Bowie's Creek, North Carolina, so about 2 hours away from where I grew up. I chose pharmacy because I always liked science, and I wanted to do something medical, but I didn't really like nursing, doctor. That really wasn't for me. And then I worked in a pharmacy when I was 16. That was my first job as a technician, and just kind of fell in love with how medications can impact us and really anything that we take in and consume and what kind of effect that has on our body. It just really interests me. I remember my first day in the pharmacy. I went home and cried because I told mom I felt like such an idiot. Like, how was I ever going to learn any of this? It felt like it was just a foreign language. But then I said, I got to go back. I have to learn more. This is amazing. So I think that really sealed it for me, that was what I was going to do. I had a great boss that encouraged me to go to pharmacy school and continue learning. So, yeah, and then I never looked back. I loved it. The instant that I went to school and all the science classes, I felt like that was really what I was called to do.
Yeah, that's so similar to my own experience. I also started when I was 16 in a local pharmacy, and my boss encouraged me to pursue pharmacy school. And also, she was the one who turned me on to like the integrative health model because she went on to get her naturopathic doctorate degree.
Oh, okay.
Yeah. So that's wonderful. So, what did you do right after graduation? Where did you practice?
Yeah, right after graduation, my ex-husband was in the military, so we moved around a lot. And I started with CVS because I knew I was going to be moving, and that felt like the easiest thing to be able to do was to work with a national company where I could easily transfer state to state. Still had to get licensed in all the states, but it was, at least I knew I had a job wherever I was going. So did that for several years, and then in 2015, I want to say right around that time frame, we both kind of started our own journey of trying to figure out our own health. I mean, some of this I feel like I never learned in school, and we're not taught nutrition really anywhere. I mean, honestly, we're not. And I felt like, okay, these are things that I need to know to be able to help my patients. Um, and it just kind of snowballed from there. Learning about the macronutrients, and I felt like I never was taught that. Exercise, what's the right amount of exercise, right amount of resistance training, right amount of running, cardio, and that just kind of spurred me along to continue this journey. And really, it started with my own health. which I think is how a lot of people do. Like there's something going on and let me do this research. And then you just kind of go down the rabbit hole of, oh my gosh, these are all these things that I never knew. And most importantly, like I've had a lot of like stomach issues my whole life, and just learning how to deal that without medication, it is entirely possible. And that's kind of what I'm trying to impart with people that come into the pharmacy, and especially proton pump inhibitors. They get put on those and they never come off. And they are lots of dangerous side effects with those. I had that myself because I was on one for almost 15 years. I'm
Wow.
still dealing with the aftermath of that and trying to heal my stomach. And it was gluten that is the main source of problems for me. So it's pretty crazy.
Yeah, definitely. A lot of people start doing this work and start looking into alternative options of
Yeah.
healing when they themselves suffer from some weird, obscure condition,
Right. Yeah.
or if they have to chronically be put on a medication and they want to get off, or if a family or loved one is diagnosed with something and they want to
Yes.
start researching and helping. So I can totally relate to. I was put on a proton pump inhibitor as well when I was, I think, 20 or 21.
Uh-huh.
So that was, and then I was on it for about 6 months before my pharmacist actually encouraged me to start, you know, treating my diet differently and taking a probiotic and switching to less acidic foods and, solving my issues that way. So that really started me on my path and my journey as well. I could totally relate.
It's pretty amazing how taking something that I mean, most people don't even think is a real issue right now, sadly, and then just totally taking it out, and it's like a complete miracle. I mean, now that I don't have to take any medication for like for acid reflux, and I had to do that my whole entire life. I mean, my parents truly believe it is just an absolute miracle. Like they can't get over it. I mean, I used to not be able to eat. I mean, it was ridiculous. And just a few simple things of just not eating it. And who cares? And people ask me, oh, don't you miss like cakes and cookies and bread? Well, no, because that hurts me. So like I understand now, and trying to get people to realize that it's not really that much of a sacrifice if you don't have to take medication for the rest of your life. That's expensive, and all you have to do is control it with what you eat. Um, I think that message doesn't get out in the doctor's office, and I hope to try to like encourage people more to think along those lines, and hopefully one day it'll all be functional medicine and the system that we have now will be gone.
Yeah,
That's what I pray for, but
agreed, agreed. I also find that a lot of the times patients want a prescription and want a quick fix for their symptoms.
yeah,
They don't realize what they're signing up for when they take an extra antibiotic or
right,
on a proton pump inhibitor, or they go to some invasive procedure when it could be avoided. So, like, insurance plans can approve it, doctor can approve it, but usually we were taught to do non-pharmacological methods first, and somehow
right.
nobody wants to spend the time doing that.
Yeah, no, I mean, nobody wants to do that now. And I've really made it a point, and this is just in the last couple of years too, of trying to impart the dangers of some of these medications long term. Because I mean, short term, okay, I understand there's lots of different reasons why we have to do that, but people need to know that over the long term, hey, if you're going to be on this, then you could be B12 deficient. I mean, you could have micronutrient issues. And that's really what happened to me. And it's a miracle that I don't have thyroid issues right now because of being B12 deficient for almost my whole life now because of this medication. And people just don't realize, and they're very shocked too. I found out lately when I just give them even as one or two, hey, this can cause this this issue here. If these interact, you could have um, dizziness, headache, nausea. I mean, there's all these interactions, and I don't think that they get that in the doctor's office. I think they get that this is great, this is going to solve all your problems, and that's just really not the case.
Well, so a patient comes to the doctor, they have a problem. The doctor gives them a prescription. They go to the pharmacy and they fill a prescription, but they don't realize that they're going to have to be on this in order for the symptoms not to come back. As soon as
Right.
they get off, the symptoms are likely to skyrocket back up,
Mm-hmm.
negative feedback, and everything like that. So it's actually very hard to, once you start, get off or take
Yes.
off. And so we as pharmacists know the side effects, but we often, I feel like, have to walk that thin line of educating the patient to the point where they don't take the medication, because that is how the pharmacy makes money, by dispensing the medication.
Right.
So if we start to tell them this whole list of side effects, then they'll be like, actually, maybe I shouldn't take it. So it's like a very, actually very interesting position that we're put on, where we
Yes.
educate and then they might not take it. And then now we have to fill in the gap and tell them something that will solve their issues, but the payment is not coming through that way.
Yeah. Yeah. It's very difficult. I find like sometimes I'm just trying to walk that line of like, how I really want to help people, and I don't know if this is necessarily the way to go, or can you try something else, and then there's time constraints, and um, I think for the most part, most people, I haven't had anybody say I don't want to take that now, but most of them are like, thank you for telling me that, because my doctor told me nothing. So that is kind of how I feel like I'm trying to broach the subject. And hey, also, if you're doing this, have you thought about this? I do that a lot with especially the proton pump inhibitors. Hey, here's the medication, these are the side effects. Have you thought about getting a food sensitivity test? Have you thought about eliminating dairy or gluten, and trying to just put those like little bugs in their ears so that they'll think about those kinds of things too.
Yeah, absolutely. So I find myself in the same thing, like, recommending probiotics when they're in an antibiotic. If maybe a digestive enzyme is what they need, recommending like papaya seeds or
Yeah.
pineapple. And again, looking at their diet and what's
Mhm.
causing them to not digest, or maybe suggesting bitter herbs to help them with their digestion and liver function.
Yeah.
So it's tough. I feel like we were
It is
put in
very
a
tough.
predicament.
It's getting harder and harder, because more people are taking medications. I mean, it's just a thing. Everybody takes medication, I feel like, and then it's more and more, and all these different interactions. And I find myself like just looking at a profile and like, oh my gosh, this might interact with this, and it's so difficult to impart that information, and then to make sure that we catch those interactions too,
Yeah,
that a lot of times the doctors are not aware of, or they're not looking at it, and they're not thinking along those lines. It can be really, really difficult.
yeah. Or like, let's say we know a few big interactions, right? Big no-nos, and we catch them. But then a lot of them we don't know, especially if somebody's like on 15, 20
Right.
medications. We don't really know how they interact in the body and what to do.
Yeah, I mean, who knows? I mean, everyone's a little bit different too. Yeah, it's just becoming an overwhelming thing. I think all the interactions, just the overwhelming sense of trying to manage all the drug interactions and make sure we catch it if it's there. That's the sad thing. Like sometimes I'm so scared I'm not going to catch an interaction, and I definitely don't want to do any harm to anyone.
Yeah.
Um, so that's a fear of mine now.
Yeah, and I was just talking to somebody else, another pharmacist, in one of my podcast interviews about the whole overall burden on our healthcare system with the
Yeah.
medications and how if something's out of stock or in back order or supply issues, that all affects our care for the patient, but also we could avoid a lot of that if we do the non-pharmacological methods of
Yeah.
keeping people healthy.
Yeah, and definitely, and the preventative for sure.
Yeah.
Yeah, especially now. There, I mean, it seems like there's almost everything is on back order, and it's like I don't know when I'm gonna get this in, and now I'm not sure about this one, and it's just it's terrible.
Yeah, this situation, as horrible as it is, opening our eyes to a lot of problems or potential solutions too,
Yeah,
to not have these supply issues and just reserve maybe the medications to the people that really need them in acute care settings. And then in the outpatient, if there could be more education towards better, self-care and things that you could do to mitigate some conditions.
yeah,
Yeah. Another point that I wanted to make, let me think. So say somebody comes in and they don't want to be on a medication. So now, as a pharmacist, we're not really allowed to take them off their medication. So I feel like a lot of times people who have insurance, they will opt to take the medication that's covered.
right.
But as soon as something is not covered or they don't have insurance, that's when they'll start thinking, okay, what else can I do?
Yeah, what can I do now?
Yeah.
Yeah,
So I think insurance is a big part of the picture too, because if they pay for more preventative means, then we wouldn't have all this financial burden on getting a medication.
yeah, yeah. Especially like the preventative, as far as like insurance should pay for. I mean, I think some do, but not all of them. A gym membership or personal training or a dietitian to help you lose weight. I mean, I feel like there's all these things that insurance should do, and it's not always there. Um,
No,
and the same with some of the physicians' offices and having a dietitian on staff, having a personal trainer on staff. I mean, I feel like that is the way to go, and that's the future. Is someone comes in and they can be seen by the doctor, be seen by a dietitian, be seen by someone who can help them build an exercise plan. And that's kind of like what I'm trying to do with my company, is to get into that niche. And I would love to work with doctors' offices. I had, it was gonna happen this summer. I was working with a chain of doctors' offices here in North Carolina and be a part of their diabetes education program, which was 6 like classes that they would come to, and we were going to do medication management and then also have an exercise piece, which they did not have until I talked to them, because I feel like that's very important. And now I don't know what's going to happen with COVID, because they were going to try to change it to web classes,